Hi, I hope this video finds you and your family well and safe. This is Dr. Omar speaking to you from Balsam Clinic, the Integrative Naturopathic Medicine Clinic in London, Ontario. Through my last 25 years of experience in medicine and in the last decade working as a naturopathic doctor, me and my colleagues, find such situation in the world like what we have now, COVID-19. So I found that it is important from my side to discuss with you a certain point that is not discussed before from any aspect. I mean by that we will find in this video some information that could be new for you. Really, I would like to explain why we are following certain instructions during this pandemic, and I found also that we have lack of knowledge in public about the immune system and natural immunity and how can boost this immunity to be better in face of this COVID-19 virus. So to start with, I have to tell you that any microbe in the world needs one of three ways of transmission to go through the human body. The first one is the ingestion. So mouse entry of certain organisms that may affect our digestive system and maybe absorb it and go through the blood system of the body or working through the digestive system inside the gut. And this way, it's not the way of COVID-19 in our case, but it could be for cholera, for E. coli, for salmonella, for food poisoning, any other organism that work through the digestive system. The other way, the second one, is bloodborne transmission. This bloodborne transmission, in this situation, the organism or the microbe will go through a crack in the skin of the human body, either due to a wound or because of injection or whatsoever, that will go through the skin to the blood. And they called it bloodborne infection or transmission. These bloodborne organisms like hepatitis B, hepatitis C, like AIDS, like sexual transmitted disease, other organisms that will be easy for it to go through the blood circulation through the skin directly. The third one, which is the most important in these days, is the organisms that enter our body through the inhalation. So we get this organism, either virus or bacteria, through the respiratory system, through the mouth and nose. This is the opening of the respiratory system. And we have two transmission ways for these organisms to be transferred to our body. The first one is the droplet infection. So whenever the person may sneeze or cough or something like that, the droplets come out from his mouth and his nose. It will fly till it will reach to the other person, and this other person will be infected and will get the virus. Or these droplets will drop on any surface around the area of this infected man, around 6 feet, in average from 3 feet and maybe more than 3 meters sometimes, according to the size of organisms. So size of organism will be the main factor that will keep this droplet to fly for a longer distance and to go far than we expect. But the COVID-19 virus is a medium-sized virus that will not exceed than 6 feet as a spread in the air. The other way is the airborne, these very, very small viruses or bacteria that may fly without drops. And the example for that is TB. But let us speak about our situation now with COVID-19. We are looking for how this COVID-19 virus will be transmitted from a person to another one. So the first one is direct contact. And that's why we ask you to make a physical spacing or distancing between you and any other person. So even if he has infection, these droplets will not come to you as you are taking more than 2 meters away from this person. The other way of infection is that drops will go over any surface, and another healthy person may touch this surface, and at that moment he may take it through his clothes or through his skin or his hand, and he will put his hand, for example, over his nose or mouth, and then the virus will go inside. And that's why we ask everybody to wash your hand as much as you can, so frequent. So even if any virus will come over my skin or my hand, by water and soap, this soap will remove the attachment between the virus and the skin of this person, and the water will wash it out away from our body. So water and soap is very important. The other solution is the sanitizers. Sanitizers with alcoholic base will destroy the virus itself. So either to use sanitizer or to use hand washing with water and soap, we will get rid from these viruses that may attach to my hands or your hand whenever you touch an infected surface. The other thing is the infected surface itself. We have to clean it. So that's why we have to swipe all kinds of surfaces, especially if you will go out and come back with any stuff, or we have some bags or even our shoes. We have to be sure that we disinfect everything we went outside with. And this is the important thing that will prevent these organisms to come with us from outside to inside our houses. And don't forget that the virus itself can resist dryness and heat for more than 12 hours, maybe up to 3 days. So it's very important to inform you that temperature and dryness, heat I mean, and dryness will prevent this virus to live outside of the body. But once the virus will go inside the body, this is another story. It will control the cells, especially in the respiratory tract, starting by the nose and mouth till it may go to the lung. And at that moment, it will let these cells to work as a servant for him. So it will build up its envelope. It will let this virus to develop and to reproduction will start to increase, and the infection will be more and more inside the body. But very important point here is everybody will catch this virus, will be infected, and his system will allow this virus to work inside his cells? No, for sure. We have a very important system in our body named immune system. The natural immune system inside the body will protect us from inside against this virus, because like any system in our body, like the cardiovascular system, like the digestive system, all these systems formed from some organs that produce certain kind of job. Blood circulation, digestion of the food and absorption, respiration, so it will be to gas exchange and oxygenation of the blood. The same for the immune system. Immune system formed from certain kind of cells named T lymphocytes. And these T lymphocytes, if you will see it, you'll find that it has its own weapons, like they called it antibodies, that will go and kill, destroy, and eat also all kinds of abnormal organisms may come inside our body. And that's why it is very important for us to know how can we activate and improve the level natural immunity in our body. How can we let these T lymphocytes inside our body to act normally? Normally means to be ready for any kind of invasion by any virus or bacteria, either to be COVID-19 or any other organism. And how can these T lymphocytes will work against this type of infection? So to have a good, normal, active T lymphocytes, we need some antioxidants, we need some vitamins, we need some minerals that the body will make it inside or take it from his food. So that kind of elements will help T lymphocytes to be normal and healthy and can work against any kind of infection. Like what? Like zinc. Zinc is important for the T lymphocytes to work and to be active and to be ready to use its weapon of antibodies towards this COVID-19 virus. Also, vitamin C and vitamin D3 and vitamin B complex, also vitamin E, will work as coenzymes or cofactors to help these lymphocytes to be healthy and to work well against this kind of invasion. If I will let these micronutrients or the nutritional elements to help these lymphocytes to work well and to have it in a good balance inside our body, at that time the lymphocytes will work well. But what are the resisting factors? The resisting factors are these metabolites come from our body. If our food is not healthy enough and it doesn't contain a good amount of antioxidants, which they called it polyphenols, found in all kinds of colorful fruits and vegetables, these antioxidants will work against these metabolites, and they called it free oxygen radicals, and these antioxidants will work to neutralize its effect and prevent it to be a barrier between the T lymphocytes and the virus. So eating good amount of vegetables and fruits, especially the colorful one, will supply the body with good amount of polyphenols or antioxidants that will make these lymphocytes free to attack this virus without barriers of these free oxygen radicals. Very good. Second point that may resist the work of T lymphocytes is pollution. Our community now could be polluted by a lot of heavy metals and a lot of chemicals, especially in our food. We read a lot about preservatives, and we read a lot about pesticidal materials that contain a lot of chemicals which work as a barrier to prevent these T lymphocytes to work and to be active against the virus. So what we are advising now is to let everybody, whenever he chooses the material and type of food he eats, he has to take care to avoid any kind of preservatives, especially in these days. So taking a good amount of supplements and minerals, especially zinc, vitamin C, vitamin D3, and B complex and vitamin E, avoiding any kind of pollutions, eating well of healthy fruit and vegetables, so I will not make a lot of metabolites contain free oxygen radicals that prevent the action of lymphocytes. The third item I would like to talk about it is the effect of chronic debilitating disease in the activity of T lymphocytes. As we know, we have chronic disease like diabetes, like hypertension, cardiovascular diseases, also like autoimmune disease that may need some treatment, heavy treatment, for example, cortisone, anti-cancer drugs. All these kind of medication may have some side effects and adverse reaction that interfere the good activity of T lymphocytes. So those people suffering from this kind of chronic disease, we call them a high-risk group. High-risk group because their immunity usually is less than the normal, even if the lymphocytes are good. But because of their general condition is not healthy enough, at that time the activity of these T lymphocytes will not be good enough to protect this guy against the infection of any microbes, especially the COVID-19. So we advise all people with chronic debilitating disease, especially in senior houses, especially in long-term facilities, to make good isolation in these days, because they are in a high risk to get the infection. Why? Because their immune system is impaired by a way that we cannot correct it easily. They have a chronic disease, and even those with old age, the lymphocytes will be aged a little bit, so its activity will not be like the young man. And that's what we saw in the statistics we have, that this COVID-19 may affect more the older people than younger one. Why? Because the T lymphocytes are older and it's not active like those in age less than 30 or less than 20 years. So those people more than 65 years or 70 years will consider them as high-risk group also. So I received a lot of questions. How can I check if I have a good immunity and I have a good immune system or not? Is there any kind of laboratory investigation or blood test so I can check my immune system, like what I'm doing for my heart, for my stomach, for my digestive enzymes, for my liver, for my kidney? Unfortunately, if even we have some kind of investigations that may show the activity of immune system, but it is not available everywhere. Not every lab has this kind of laboratory, and it is very sophisticated, and sometimes it is academic. So the meaning of academic is could not be used in public easily. For this reason, the Scandinavian group of scientists developed certain kind of questionnaire. They called it Immune System Assessment Questionnaire. They used certain kind of symptoms that happen frequently with low immune persons, and they put it in 7 questions, and according to the level of frequency of such symptom over the last 12 months, we will consider how much the score of such symptom. At the end of answering of these 7 questions, we can calculate all and categorize the level of immune system easily without any kind of blood test or investigations, and it will be very cheap. We can screen it for everybody, and even it is a self-assessment. Anybody can do that. And by the way, it's available on our page on Facebook and our website balsamclinic.ca. This questionnaire is formed of 7 questions, as I said, about the following symptoms. First one is fever. If you have any kind of attacks of high sudden fever in the last 12 months. If nothing at all, you will take 0. If you have it but in few number, it will be 1. If it is in 50% of your days you may have fever, it is 2. It is more than 70, it is 3. If it is up to 90% or 100% of days, we will give 4. These scoring levels will be followed in all coming questions, also other symptoms. So the first one is for fever. So either 0, 1, 2, 3, 4. The second symptom is diarrhea. If you have it frequently or less frequent or nothing or almost always. The third symptom is headache or migraine. If you have attacks of headache and migraine in the last 12 months, if it is nothing, it will be 0. If it is yes, but with low frequency, it will be 1. Yes, with moderate frequency, it will be 2. Yes, with usual frequency, it will be 3. And if it is almost always, it will be 4. This is the third one. The fourth one is skin disorders. Any eczema or acne or psoriasis or something like that. Also, if it is frequent or not, according to the score for it, 0, 1, 2, 3, 4. The fifth one is muscle pain and joint pain. If you are complaining of low back pain or joint pains or knee pain or shoulder pain, according to the frequency, I will give you the score from 0 to 4. The sixth one is common cold symptoms. Runny nose, blocked nose, body ache. These symptoms of common cold will be considered as low immune symptom, and according to the frequency from 0 to 3, 0, 1, 2, 3, 4, we will put the level according to the score. And lastly, last symptom is coughing. Coughing is one of low immune system symptoms. So it is the same. If it is nothing, no cough in the last 12 months, it will be 0. If it is yes, but with low frequency, it will be 1. Yes, with 50% of frequency, it will be 2. 75% of frequency, it will be 3. 100% of frequency, almost always I have cough, so I will take 4. So we have 7 questions with from 0 to 4 scores. So our scores will be either from 0 till 28 from 7 questions. And we will classify or categorize the level of immune system to 4 levels according to these readings. Where is it? From 0 to 7, it will be a very good immune system state, good natural immunity. And those will come in this level. We will advise them to continue the same good lifestyle and eat well of vegetables, fruits with colorful materials, which is polyphenols, and they are good. The second, from 8 to 14, they consider them as mild impairment. So they have a defect in their lifestyle. So please take care and move forward to improve this lifestyle you have. The third one, which will start the dangerous one a little bit, will be the moderate impairment of immune system. And this is the score will be from 15 to 21. And we advise those people to go immediately to their family doctor, and he will work on their immunity, improve their lifestyle, and also he may make some investigations to check the blood picture, liver function, kidney function. Let us see where is the problem. So the fourth level, which is the worst level of immune system, is from 22 to 28. It means that severe immune system impairment. And if anybody will fall in this category of severe impairment of immune system, we have to refer him immediately to a specialist, either through his family doctor or any other facility. But a specialist of immune system should take care of him because he has a lot of work. And I would like to mention a very important thing is any patient with risk group, like age above 65 years old, patient with chronic disease like diabetes, hypertension, bronchial asthma, and smoking, patient on steroid therapy or other kind of medication that may interfere the action of lymphocytes, patient with a history of cancer or received chemotherapy or radiotherapy in the last 12 months, we'll consider them as high risk group. That will drop them down from level to level. If they are in the first level, so we will put them in the second one. So we will reduce the level of immunity if they are from the risk group. Not only like that, very important issue I'd like to mention here, it's not only the physical lifestyle, it's also the mental health and mental lifestyle. So any disturbance in stress or sleep pattern, I mean by that overstress, that will let some hormonal change to happen inside our body that may affect our immune system. Like what? These T lymphocytes is produced inside the bone marrow, and then it will go to a thymus gland between the two lungs to be activated under the effect of a hormone named melatonin. Melatonin is secreted from the pineal body or pineal gland in the base of in the brain, in the base of the skull, and this melatonin, the main function, as we know, is the circadian rhythm and biological hour, secretes during dark time and let the body to be relaxed and with low voltage, as they said. But at the same time, it has a very important function, which is the activation of T lymphocytes. So these T lymphocytes will be active with good weapons, like these antibodies over it, to be active against the viruses, especially COVID-19. That's why we advise all people now to have a good portion of sleep, not less than 8 hours daily, to help this melatonin to activate our lymphocytes. This is first. Second point, stress or overstress will let the cortisol hormone to be high and high. And we know all, and I mentioned that in my previous lectures, this cortisol, whenever it is very high, it inhibits or prevents melatonin to release. That's why we have insomnia, we have fatigue, we have a lot of complications because of overstress. And at the same time, we have low immunity. Why? Because we don't have enough melatonin, and we don't have good activation of our T lymphocytes. So it is not only the physical health, but also the mental health. And that's why I am usually saying and insist that our health is not a gift. Our health is a credit. We have to build it up. We have to improve it. Because if our health will not be managed, we will find that we have low immune system and we cannot resist any kind of infection. At the end, I hope everybody will be safe in these days, and let everybody to understand why we are using these precautions, why it is important to build up our immune system, and how this immune system is working. Enjoy your days, take care of yourself, stay home, and be healthy. Thank you so much.